The World Heart Day is a day set aside usually to discuss the problem of heart problems and vessel problems. It's on the 29th of May of September every year, and it's a day for enlightening people about the issues, the problems that involve the heart and the blood vessels in our country. Because of improving, people are eating things that are not as natural as what our forefathers ate. We are having situations where we have more heart problems, including heart failure, hypertension, and all that. And again, in children, because of industrialization, we're having more pollution, and we're having more incidences of heart diseases in children, what we call holes in the heart. But again, conversely, we are fortunate that just as industrialization is throwing up things that can predispose people to anomalies, we're also having the technologies to be able to address this. And the Grace Cardiology Center has been able to provide those opportunities and facilities to reduce medical tourism that continues to drain billions of naira from Nigerians. So it's our honor to discuss the burden, the problem of heart diseases in Nigeria, and the current opportunities that are available in Nigeria for our people to be able to access information, preventive care, and curative care of these heart problems. There are some statistics, but the problem in this environment is that we don't have so many people who have the skill to diagnose, to identify heart problems in children. But generally, we know that globally, the frequency is almost constant. About 1% of all births, all children would have heart problems, congenital heart diseases they were born with. And in Nigeria, we have between 70 to 80 million children. So we can say that about 700 to 800,000 children in Nigeria would have heart problems, congenital heart disease, what they were born with. Majority of them, we actually don't know the causes, but we know some risk factors that can predispose people to having congenital heart diseases. So, but majority of cases you won't even know why it happened. We know that some infections, some mostly viral infections that parents may have, especially mothers when they are pregnant, may affect the child, and then the child will have a structural heart problem. Like rubella is very important. But now we have immunization for rubella, so it's also an opportunity for us to impress upon our people the need to have our mothers immunized, especially during their teenage years. Okay. The other thing is, if there is a family history, maybe a child already had been born in a family with that structural heart problem, it increases the risk of another child being born with it. So it's important for any family who already has a child with a structural heart problem to have subsequent children or existing siblings to be screened. Another risk factor is diabetes. If the mother has diabetes, it increases the risk of some structural heart diseases in the children. So the condition that the mother has. Okay. Some other skin problems, like some skin problems, can also be a pointer that a child may have some heart problem when it's born by the woman that has it. But generally, in majority of cases, we wouldn't be able to say for sure. The other thing is drugs. Some medications, when mothers take them when they are pregnant or within 3 months of getting pregnant, that their child can have a hole in the heart. So these are some of the common predisposing factors to structural heart diseases in children. People have freedom of movement, and no matter what you have to provide for people, they still have the right to choose to take it or not. But majority of cases are due to ignorance. They may not know that some of these things are available in Nigeria because they've not been available for some time. The sad story is that the first cardiac surgery in Nigeria was done in 1974. That's like 44 years ago. So we expect that by now we should have moved very far into being able to do these things. But there was this period of brain drain, a lot of doctors leaving the country, and then poor training, lack of government funding, and there wasn't the expected development progress was not there. But currently we have a lot of Nigerians returning, and then so many Nigerians also going out to acquire those skills. So it's also what our collective responsibility, especially you people of the press, to tell Nigerians that some of these things are available in Nigeria now. Well, I'm sure when you walk or when you run, you notice your heart pumping. Maybe you notice your heart rate getting faster, your heart is beating faster. Okay, that tells us that the heart actually is related to walking or activity. So walking is very important. It's recommended that we walk at least 30 minutes daily. So up to 3 to 4 hours walk a day, a week. A brisk walk will help your heart to contract. Just the way you exercise your muscle, the heart needs to be exercised for its health, for blood to flow to different parts of it. So it's very important. When we do the brisk walk like what we did now, you notice that you're sweating, your heart is beating faster, and then you're exercising the heart. So it's some form of introduction to healthy habits. And in this World Heart Day, we want all of us to learn healthy habits that promote the health of of the heart and the blood vessels. So it's encouraged, instead of using our cars all the time or taking buses to everywhere we're going to, we need to exercise. And even at workplaces where we do sedentary work, sitting at one place, it's important for us to get up from time to time or have programs at workplace that improve activity. Apart from losing weight, the heart is very, very important. The heart is one of the organs in the body that does not rest. Even when you are sleeping, it's beating. So you need to keep it fit. In healthcare, is a teamwork. There is a collective project, and we work together. And the trust is to provide the best information, the best care to our people. So we are all working together to provide that. We're all stakeholders, the government, the people, the press people, everybody should have that interest to make Nigerians healthy. And I know that there are some policies of government aimed at improving the health of Nigerians. But if I would suggest something, it would be health insurance. Because no matter the information you provide to Nigerians, and if they don't have the ability to access this care, to afford it, then they will not be able to do it. So health insurance is very important. Universal coverage is very important, so that Nigerians will be able to access health at the most local level. In our own center, we would be more like referral centers, but these cases are in the communities. So those people, extension health workers, nurses, doctors working at local levels should be also trained, and then they should have the capacity to be able to refer those cases. But if people are not empowered to be able to access healthcare in facilities, then they will stay at home, and there will be complications and cases will be missed. So I think the government is doing a lot in terms of the primary healthcare. I know there are efforts to build more primary healthcare, refurbish them. But empowering Nigerians to be able to access this healthcare, so that people don't pay out of pocket, especially for cardiac problems. very expensive, and people need to be covered. They need to be able to access healthcare. Some states I know, Lagos State, some other states are making efforts. Anambra State, they are making efforts to start health insurance, and the facility were very open to collaborating with these organizations to be able to give our people access to the cardiac health. Exercise, that's where exercise is actually something that people should be very careful about. Before you start strenuous exercise, playing football, and very contact sports, you need to be evaluated by a doctor. They look at your heart and then your blood vessels to be sure that you don't have risk factors. Some of these people already have a risk factor that needs to be addressed, a condition that needs to be addressed. So those people, their exercise is supposed to be designed. It's not, exercise is not a general thing, especially contact sport. For instance, if you see in some areas, when people are employed to play for some teams, they do medicals first. But in our environment, because we really don't have these centers and these expertise, and though again our lack of awareness, some people play football and then they have been playing football, top football in Nigeria for a long time, but they've not had cardiac screening. And then when they go overseas, they have the cardiac screening and it's picked up. Or they play and then they drop on the pitch, they fall on the pitch and have a cardiac arrest because that diagnosis was not made. So it's difficult to say it's one thing that causes it, but there are several things, from conduction problems to structural problems, that can lead to people having cardiac arrest. Some of them are acquired, some of them they are born with them. So it's important for us to periodically have health screening, especially now that we have all these facilities.
It's difficult to give a straight figure of cost for cardiac illness. The question is, what sort of illness are we talking about? Is it something that can be treated on outpatient basis, or is it something that requires hospitalization? Okay? What you may want to know, perhaps that may be more helpful, will be the cost of perhaps routine cardiac checks that may be part of cardiac care. Someone who comes to the hospital who has had a heart attack, the cost of care for such a person will be different from someone who has heart failure, which will be different from somebody who is just a hypertensive, getting medications on outpatient basis. So cardiac conditions in general, difficult to give you a straight answer. We're not trying to keep information back. I think the thing to say is this: even when patients call to make some of these inquiries, what we tell them is we give you some idea of fixed costs. So for instance, if someone is on admission in a place like this, the way we operate, you pay doctor's fees per day for 10,000, you pay nursing fees for 10,000, then the bed fee will depend on the bed and the room you're taking. Just like happens in a hotel, there are different categories of rooms. The medium cost, the cost of a medium space here is about 30,000. So that comes to about 50,000 per day for hospitalization. That does not include drugs. We can't give you fixed cost of drugs because it depends on what you have and what we are giving you. What test might you need to do on a day-to-day basis? Again, it depends on your condition. Some days we may not need to do any new tests. Some other times we may have to do a lot at entry. So the figures will vary, depends on what we are dealing with eventually. For adults, this time around, we're not talking about people at the younger age. Children who have heart conditions, more often than not, those are conditions, they are born with them. Okay, but for adults, when somebody comes to the hospital as an adult who has what you might consider a heart problem, I as an adult cardiologist, because we know that if you didn't have those problems in childhood, then you're looking at something else going on in your body which is affecting the heart. So our own task is to identify what that factor is and address it. Okay, so the common conditions that could lead to a heart problem in an adult, one has high blood pressure, high sugar levels, lifestyle habits like heavy alcohol intake and cigarette use. Those are the common ones. So to avoid heart disease would mean finding a way to prevent these conditions from becoming established. and if they've been established, to address them early enough so that they don't then damage the heart and the person now has a heart problem. One more thing to add on, of course, lifestyle conditions that leads one to gain a lot of weight. In other words, sedentary lifestyle, jobs that do not get you to move about. Those things themselves are a risk, and a lack of exercise as well. Okay? So the parts of it that the individuals have some control over, people should ordinarily be considered to have control over their diet and their weight and their ability to exercise. So if we could adopt healthier lifestyles where we are much more active, we eat healthier so we maintain a good weight. And I think another factor as well is stress in its different manifestations. Minimizing stress would help. Of course, stress is a bit of a woolly thing. What we mean by that is, I mean, people would avoid stress if they could help it, but sometimes you can't. The conditions of living in a metropolis like Lagos creates itself a measure of stress that a great many people can't do anything about. People travel long distances to get to their places of work, not because they love the trip, but because that's where they will get a good job. If they could get a decent paying job next door in their neighborhood, they wouldn't go elsewhere, okay? Or if they could afford to live where they work, then they'll move over to those places, and usually the rent will be very high. So people make the best of what they can out of their situation. I'm not aware that there are organizations in the country that are explicitly founded to help patients who cannot afford care to access care in hospitals, apart from something like the Kano Wanko Foundation. I'm not aware there are any other such foundations. And there is not much support from the government for people who are providing health care in the private sector. Not at all. If anything, you are left to operate in the same space as everybody else, and even may have more difficulties to contend with. One of the branches of this hospital in the GRA on the other side, Reddington, we've had people from the local government come there asking for extra money that we should pay to them for having TV on the premises. So you can imagine that. So the same problems that other people have, we have to contend with them as well. The generator is on, and the generator is the default power supply for most businesses in the country, not NEPA. Nobody is going to sell fuel to you at a lower price because you're running a hospital. You simply have to find a way to factor in all your costs into the bill you give the patients. So that's part of why healthcare is expensive. And not because the doctors want to take undue advantage of people who are ill, but because the climate for doing business in Nigeria is tough for everybody.